Welcome to the next climbing conditioning workshop, where the focus was on climbing injuries. In particular, we looked at injury management pathways and injury prevention pathways. From the research that's been done, it's no surprise that upper body and hand injuries come top of the list. And we started the workshop by just reviewing various acute injuries and chronic injuries. From a functional health and performance point of view, it's going to be key to have an actual pathway or a model or a system in place so that you can actually manage these injuries and to prevent them from being an issue. In this case study, we can see how a typical rotator cuff injury for a climber can be improved on. If we use the right methods at the right time and put them together, we can make changes in performance in terms of strength and endurance and recovery, but also in eliminating pain. As a practitioner working with climbers, it's important to start with assessment. And we looked at various things, and on the workshop we were just looking here at some range of motion assessments for the shoulder abduction. And we noticed different quality of movement, differences left and right, issues of pain and things like that. So we focused on just a tiny little bit of some soft tissue work, and without even any work onto the shoulders, actually gave it a kind of postural focus and worked on the thoracic area here and just did very light moves to over the fascia basically. And when we retested, we saw quite significant differences. In the second part of the workshop, we looked at injury prevention and developing a pathway of methods, strategies, therapies that gave us the greatest results in actually reducing the risk of injury. Again, assessment is going to be the first protocol here, and as an exercise, nutrition and lifestyle coach and soft tissue therapist, this is where we start to look at posture. First rib angle and thoracic positions, where the head is and head carriage is. Here we looked at breathing patterns, which has a myriad of effects if it's actually dysfunctional. So part of an injury prevention program could be to work on those postural issues, to do breathing practice, to get the diaphragm working correct, to create a good healing environment in the body, to hydrate, to reduce stress and load, and all these key things that can help us with our climbing performance.